Welcome to the MediByte channel. As a healthcare professional right here at MediByte, I know firsthand that navigating fertility challenges can feel, well, totally overwhelming. Today, we're going to dive into the deeply frustrating paradox of unexplained infertility, and we're going to map out a clear medical path forward. My absolute goal with this explainer is to translate the clinical data into a highly visual roadmap so you know exactly what options are sitting on the table for you. Let's get right into it.
You know, it's incredibly isolating to do everything right, to get these totally normal test results back from the lab, and still not conceive. You might be sitting there asking yourself, if literally nothing is wrong, why on earth isn't this working? Well, let's peel back the layers and see exactly how medicine approaches this mystery. We aren't just going to shrug our shoulders and say good luck. We actually have very specific, evidence-based protocols to help you achieve a successful pregnancy.
First up, let's break down the actual terminology. In the medical field, unexplained infertility isn't simply a lack of answers. It's actually what we call a diagnosis of exclusion. Essentially, this means your healthcare team has systematically played detective and completely ruled out the standard physiological causes of infertility. The sperm is normal, the eggs are healthy, ovulation is happening right on schedule, the fallopian tubes are wide open, and the uterus is perfectly fine.
So the absolutely crucial takeaway here is that all of your vital reproductive systems are functioning exactly the way they should be. Now, when a doctor walks you through this exact diagnostic checklist, it can honestly feel like a dead end when everything comes back normal. But actually, scratch that. From a clinical perspective, this is genuinely great news. It confirms that your reproductive foundation is totally solid. And that allows us to pivot straight away from diagnostic testing and jump right into proactive, targeted treatments.
All right, so let's move into step 1, controlled ovarian stimulation.
So our very first line of medical defense for unexplained infertility is a highly effective approach. It's really designed to make pregnancy far more likely and help you conceive much faster than if you were just trying naturally. It's a pretty precise 3-step process. First, we prescribe a fertility medication called clomiphene. What this does is stimulate your ovaries to mature several eggs at once, rather than just the usual single egg. Second, we give you a hormone called HCG, which acts as a trigger to release those mature eggs. And finally, within about 2 days of that trigger, we perform an IUI, or intrauterine insemination. This is where active semen is placed directly into the uterus, which effectively bypasses the cervical mucus entirely and gives the sperm a massive head start toward the eggs.
Now, we definitely don't want to drag this process out forever. Doctors will typically try this exact controlled stimulation method, the clomiphene, HGC, and IUI, for up to 3 menstrual cycles. This specific time frame is the sweet spot. It gives the treatment a fair, statistically significant chance to work without causing you unnecessary delay or, frankly, treatment fatigue.
But we do have to ask the practical question, right? What happens if the initial treatments just don't work? If those first 3 cycles don't result in a pregnancy, we don't just sit around and cross our fingers. We immediately look at the next strategic escalations in our medical playbook.
So, if clomiphene is unsuccessful, we weigh 2 strategic options. Option A is to use much stronger injectable hormones called gonadotropins, followed again by HCG and IUI. Option B is to move immediately to in vitro fertilization, or IVF. What really drives this decision, though, is the risk associated with option A. You see, gonadotropins have a significantly higher risk of resulting in a multifetal pregnancy, meaning twins, triplets, or sometimes even more.
Because those stronger gonadotropin treatments carry such a huge risk of multiple gestations, clinicians very often just say, okay, let's proceed directly to in vitro fertilization. IVF gives us an unbelievable clinical advantage here. It allows the medical team to safely control the exact number of embryos that get transferred back into the uterus. By totally skipping the stronger stimulation meds and going straight to IVF, we drastically lower the risk of a pregnancy with 3 or more fetuses, which honestly makes the whole process much safer for both the mother and the babies.
Furthermore, we always tailor our approach to the individual patient, and age is a super critical factor here. Evidence actually suggests that women over the age of 38 with unexplained infertility conceive much more quickly when they proceed straight to IVF. For this specific demographic, we often recommend skipping the controlled ovarian stimulation entirely. It's really all about maximizing your time and utilizing the most direct, effective medical technology available for your unique circumstances.
Which brings us to the most important part of this explainer, the prognosis, and your actual chances of success.
We've talked about all the tests, the treatments, and the medical logic behind them, but if you are currently dealing with unexplained infertility, this number right here should provide a massive sense of relief. 65%.
Whether you step through the process of clomiphene stimulation followed by gonadotropins, or you and your doctor decide to just move immediately to IVF, women with unexplained infertility have a highly reassuring 65% chance of achieving pregnancy. Modern medicine has very clear, defined pathways to overcome this hurdle, and the vast majority of patients who follow these treatment protocols will go on to build the exact family they desire.
So if you are staring down a diagnosis of unexplained infertility today, please remember that you are certainly not out of options. In fact, your treatment journey is really just beginning, and the odds are very much in your favor. As medical science and technology continue to advance at this rapid pace, it leaves us with an incredibly inspiring question. How long will it be until unexplained infertility is just a diagnosis of the past entirely? Thank you so much for joining me for this MediByte Explainer. As a healthcare professional, I am truly passionate about empowering you with accurate, actionable medical knowledge. Please be sure to like this explainer, share it with absolutely anyone who might find it helpful on their own fertility journey, and subscribe to the MediByte channel for more clear, empowering medical guides. Until next time, stay informed and stay hopeful.